more clinical perspective, the key is making sure that the right people are using the right drug for the right medical condition.
So what is a formulary? A formulary is a guide that the pharmacy benefit manager puts out that says these brand drugs are the preferred versus the non-preferred versus generics. So for example, if the average cost of a generic today is around $28, $29. Average cost of brands is probably in that $167 range.
Members might not always know what drugs are on the formulary, and certainly their providers don't always know what drugs are on the formulary. So that's where some of the confusion and disruption comes from. And we try to fill a lot of these gaps through member education. Pharmacy benefit managers do a great job of outreaching to members through snail mail, sending them letters in the mail, emails, and on their websites. But unfortunately, members aren't always receptive to that information and might not always understand that information. So what we need to do is encourage members to become smarter consumers and to make the best, most cost-effective choice for their own medication.
A pharmacy benefit manager, or PBM as we call them, they serve multiple levels of purpose. One is they process all the claims, and by doing that, we're able to collect the data and be able to analyze it and know what usage patterns are and what kinds of drugs people are taking. From that, they certainly are negotiating discounts at the drugstore and contract rates for us to hopefully be getting the best prices that we can get for the drugs that we take. But then they can also provide data on clinical reasons to manage those drugs and make sure that they're the appropriate and most cost-effective. Prior authorizations cause a lot of disruption to the member. You go to the doctor, they prescribe you go to the drugstore, they say, well, you got to, why do you need to take this drug? Then you go back to your physician, they're busy and it takes time, and so it's all disruptive at a time when you want your medication and then you don't understand it. So member education in that world is extremely important. It would be nice if we could fill that gap to where physicians knew exactly what your formulary was at the point that they are prescribing that medication, but right now that doesn't exist. For every 1% increase in generic utilization results in about a 1.5% savings in drug costs. It becomes pretty significant. But the point being is that as the drug manufacturers, as Saphira said, continue to make more and more drugs, which is a good thing, it puts more and more challenges on us to make sure that the drugs are appropriate and cost effective. So we're going to go through more disruption as a result of that, because we're going to have to get through it. But once people get used to it, then I think we'll be back. And there are a lot of new tools that are coming on the marketplace to try to help people shop for drugs. And the PBMs have websites to where you can log in under your personal account with your PBM that's administering your drugs, and you can put in the name of the drug and the details, and it will show you the best places and the most price competitive places to buy that drug. But it will also match up what your formulary is, and also if there are alternatives that are cheaper than the drug you have, it will give them to you. So there are tools. The bigger issue is helping people to understand to be shoppers.